Greetings, everyone. My name is Sarah Norman. I'm Director of Healthy Homes and Communities at NeighborWorks America. Welcome to the fourth webinar in a four-part series entitled, Can Housing and Community Development Really Improve Health Outcomes? We're grateful that you can join us today. This series has allowed us to explore various topics at the intersection of health, housing, and community development. And this webinar will specifically focus on building the partnerships necessary to make that population health improvement. Before we start the discussion today, we wanted to go briefly over the webinar logistics in case anyone experiences technical difficulties. The webinar will be recorded and posted on the NeighborWorks Health website within a week. We will hold the question and answer session until the end of the presentation, and thanks to everyone that sent in questions during the registration. All participants' lines are muted. If you have any questions during the presentation, please type your questions in the chat box and we'll do our best to answer them. You can also email questions to me at snorman@nw.org. Again, if you have any technical difficulties, please email me at snorman@nw.org and we'll try to assist. For those of you joining us for the first time, NeighborWorks America is a national nonprofit organization established by Congress to help build strong, resilient communities by providing people with opportunities to live in safe, healthy, and affordable housing, whether they own or rent. Through grants, training, and technical assistance, NeighborWorks America supports the efforts of NeighborWorks member organizations in the community development field to develop healthy homes and communities. And we engage and serve residents across the lifespan, including infants, children, older Americans, veterans, and a variety of other individuals. To better understand how community development is partnering with external stakeholders, I wanted to share a snapshot of how our network members are partnering. NeighborWorks has 250 member organizations, and in a survey done last year, 203 of those who participated reported partnering with organizations to support their work at the intersection of health, housing, and community development. The number one type of partnership was with state, city, or local governmental agency. Food-related organizations was the second most common partnering method. Foundations was third. And other organizations and types of organizations were further down the list. But you have 71 organizations partnering with universities or colleges. About 50 partnered with hospitals. Another 50 roughly partnered with insurance companies. And this really illustrates the depth and the breadth of partnerships supporting this work. This theme of partnerships has been key throughout the webinar, and we really, in each of the different webinars, we have an illustration of different sort of partnering structuring. In the first webinar, we talked a little bit about Beyond Housing, how they're working with foundations, universities, food-related organizations, active living organizations, public school systems, child care providers, to really build a partnership that improves community health. And we also have other types of partnerships. Foundation Communities has a type of partnership that with health providers, including federally qualified health centers, behavioral health providers, and others. What's interesting and unique about these partnerships are that all of them are using data to drive partnerships by using a shared measure of success. The other thing that I think stands out again and again in these partnerships is that some of the partnerships involve the community development corporations doing direct services and taking on a new role, and some of them involve the partnership organizations actually implementing the services. One of the things that's clear is that some of the organizations are using systematic frameworks to support and guide those partnerships, whether it's collective impact strategies or other national frameworks, or even locally developed frameworks such as the Ask Alliance Act framework that Beyond Housing developed. One of the organizations that we're going to be discussing today is representative of a national framework to guide partnerships, and that will be the County Health Ranking and Roadmap Program, which is sort of a national framework that's being used. We're also going to spend a little bit of time with a few partners from a local initiative in Rhode Island designed to increase healthy food access and revitalize the community. First up is we're going to have the County Health Ranking and Roadmap Program, as I mentioned. That's a national framework that sort of supports partnerships and provides a rich database and work to support that. One of the people that will be presenting is Aliana Havrila. The second up is the Sankofa Initiative, which will be introducing a locally based cross-sector partnership for healthy food access and community revitalization. Adeline, Georgina, and Andrew Cook will present there. And we will be moving on to Aliana. Aliana is a community coach at County Health Rankings and Roadmaps, which is a collaboration of the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Aliana, thank you for joining us.
Hi, thank you, Sarah, for that introduction. I'm glad to be here today and excited to share more about the tools, resources, and guidance we have available at County Health Rankings and Roadmaps. I think, could you go to the next slide maybe? There we go. This is just, today we're going to do just a brief introduction to the tools and resources available at County Health Rankings and Roadmaps. And the next slide. We always so I wanted to begin today by sort of posing a guiding question of what signs of a culture of health do you see in your community, and what tools would help you advance a culture of health in the neighborhoods that you serve? So the Robert Wood Johnson Foundation has challenged all of us to work together to build a culture of health as defined here on the slide. What we know is that a culture of health will take on a unique look in every community. We also know that to create lasting change that improves the length of life and quality of life in every community, it takes the work of many people from many different backgrounds and perspectives. Today, I want to help you think about what a culture of health might look like in your own community and better understand tangible next steps that you can take. So why is this important? This map, and I'm going to show a couple of maps, illustrates that where you live matters for your health. And this is a map of DC. And if you're born in DC or Prince George's County, your life expectancy is 6 to 7 years less than if you were born just a couple of miles away in Fairfax, Virginia, or Montgomery County, Maryland. And in New Orleans, the life expectancy is a 25-year difference from the French Quarter, which is in the purple at 55 years, to sort of the north end of the community. And finally, this map, which is a 3-mile stretch of I-94 in Minneapolis-St. Paul, you can see a 13-year difference. And I think we can all agree that differences like this don't need to exist. So what can we do about it? County Health Rankings and Roadmaps provides tools and resources to start a conversation around a broader definition of health. It provides guidance for community leaders like you to strengthen existing partnerships and form new ones, and helps community members take action to build a culture of health in their community. So now I'm going to start with an overview of the County Health Rankings. For each county, you'll find 2 rankings, one for health outcomes and one for health factors. So the health outcomes, indicated on the screen in green, help us consider how healthy a county currently is, how long people are living, and how healthy we are. We think of this as a picture of today's health. Health factors in blue help us think about how healthy a county might be in the future based on the many factors that influence health. We think of this as a picture of tomorrow's health. Oh, can we go back to that back one? So looking at the model, if we start at the bottom, we know that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of the communities. Many health factors shape our community's health outcomes. Specifically, we look at health behaviors, clinical care, social and economic factors, and the physical environments. We measure the 2 types of health outcomes to show how healthy each county is, how long people live, and how healthy people feel. So I want to use an example real quick to walk you through the model. Again, starting at the bottom, if a community adopts a complete streets policy aimed at improving the way streets are designed to encourage walking and bicycling, this can influence health factors such as transit and diet and exercise, which in turn influences health outcomes. I wanted to highlight this resource from our website using the rankings data, which can be found under the Rankings tab of the main navigation bar. Particularly in this section, the communities using the rankings data show snapshots of community engagement sparked by conversations around the rankings data. The Broaden Your View section provides additional background on the broad definition of health the rankings model describes. And the visualized data links to other websites with visual mapping of data similar to county health rankings. So now let's move beyond the rankings. So the county health rankings are intended to serve as a call to action to ignite action in communities across the country. Now I want to talk a little bit about the roadmaps to health side of our work, where we offer these resources to move from awareness to action. Before we dive into the roadmap side of things, it's important to know that there are 4 core principles that are the foundations of the roadmaps part of county health rankings and roadmaps. First, it takes everyone, all of us working together to improve the health of a community. We need to move as quickly as possible from data to action and not get stuck in analysis paralysis or drowning in data. Keep focused across the health factors, including social and economic factors. And finally, don't be afraid to take on policy, systems, and environmental change, which will create the greatest long-term change in the health for the children and adults in your community. So how do we do this work with communities? The Roadmaps to Health Action Center is an online platform which provides practical help for communities working collectively to improve their health. At the heart of the Roadmaps to Health side of our work is the Take Action cycle. And you can see that on the screen. It's the how within the county health rankings and roadmaps. From working together to evaluating your efforts, the Action Center provides tools and guidance to assist communities in taking action. There are guides that focus on the specific steps in the Take Action cycle, and there are also guides for each of the partners in the circles at the center of the Take Action cycle, which provide guidance specific to those sectors. At the core of this model are people working together to improve health in a community. Health is everyone's business, and we believe people from a wide variety of sectors have a role to play in improving a community's health. We know solving issues like low high school graduation rates, excessive drinking, or poor health care requires the wisdom and resources of people from all walks of life. You'll see several potential community partners in the blue circles in the center of the cycle. I want to real quickly highlight the Community Development Guide. So when you click on the blue circle in the middle of the Take Action cycle, you'll be taken to what we call our partner guides. And this celebrates the natural fit that the sector contributes to the conversation of community health improvement. It also talks about the opportunities that you have as a leader in the field to deepen the conversation around the broad definition of health. Finally, I want to highlight the Find Policies and Programs box on the right. From here, you can search for policies and programs that have been reviewed for evidence of effectiveness by health factor that are also related to the community development field. Now I want to spend a couple of minutes talking about specifically some of the work that I carry out within the County Health Ranking Roadmaps program, and that is our community coaching. So community coaching provides local leaders anywhere in the country with direct support to strengthen their capacity to advance health in their communities. We work with communities using the County Health Rankings model and the Take Action cycle and the RWJF Culture of Health Prize criteria as frames for our guidance. Our aim is to help community members and communities move from planning to action. As a starting point, we use the resources found in the Roadmaps to Health Action site of our website. As a community explores the tools and resources available, we will work with them as a guide on the side or a thought partner to strategically move the work of the group or individual forward. When we coach a community or individual, we guide them on how to best strengthen partnerships, enhance skills in a strategic manner, or navigate challenging policy advocacy choices. Communities can connect with us in many ways. One of the most common ways, again, I'm going to point you to the box on the right, is this Get Help button, which can be found throughout our website. It puts you in touch with a community coach, and with the support of the Robert Wood Johnson Foundation, we're able to make this help available free at no cost to communities. I wanted to just real quick highlight what coaching is not. Coaches do not advise on how to implement specific programs or policies or an extra pair of hands to draft a plan of action or design a survey. Coaching is more of a guide on the side, sort of, if you look at that picture on the right, not in the boat with you, but at your side, able to see the big picture, offer encouragement, and ask questions that will help steer your course skillfully. In other words, coaches invite participants of community teams, often 4 to 5 people, to explore ideas, ask tough questions, review tools and resources, versus telling them what to do. Coaches work over a period of time with communities using distant technology, coaching individuals or several individuals who can then take that work back to their larger community. On the screen, you'll see the RWJF Culture of Health Prize, and this celebrates the Robert Wood Johnson Foundation Culture of Health Prize celebrates what communities have done, and it's they're inspirational stories. And if you haven't checked them out, I would encourage you to go online and look at the stories of the past award winners. These criteria are also central to the work at County Health Rankings and Roadmaps. They serve as a lens through which we help communities think about how they can build a culture of health. So real quick to summarize, County Health Rankings and Roadmaps are an annual checkup of the health of each county, and the roadmaps provide tools and resources to help communities in their journey to health. We strive to increase awareness that improving community health is not something solved by a local health department, hospital, or physician. It takes everyone to improve health in a community, as health happens where we live, work, learn, and play.
Thank you, Aliana. That was a really wonderful presentation, sharing a framework about how we can use this model of a culture of health to build collaborations and move forward. Next up is a joint presentation from Sankofa Initiative, which is going to feature Adeline Newbold from West Elmwood Housing Development Corporation, Georgina Sarpong from Fresh Food Rhode Island, and Andrew Cook from Southside Community Land Trust, which really is providing us with an example on the ground of the types of partnerships that Ali was just sharing. So thank you, Adeline, Georgina, and Andrew. Adeline, do we have you?
Hello?
Hello, Adeline. Are you ready to join and share your work?
Yeah, I'm going to put you on speaker. Hold on one second. Hello?
Yes, Adeline, you're up. Thank you for sharing the Sankofa Initiative.
Hey, thank you for having us. We're so excited. Okay, so I'm going to start off, and you can just go right to the first slide. Okay, so I'm going to start off and just give you a background of what the Sankofa Initiative is. Sankofa is you can stay on the first one. Sankofa is a creation of a unique urban agricultural community in the west end of Providence. And this initiative is through West Elmwood Housing Development Corporation, which is a community development corporation that's been revitalizing homes and the community since 1970. And so the word Sankofa is from the Akan Ghanaian language that translates as reach back and get it. San to return, ko to go, and fa to fetch, to seek or take, which is represented by the bird with its head turned back and taking an egg off its back. Sankofa began in 2011, and it was backed by a committee of local stakeholders and residents to attempt to address the assessed need of food disparity in the West End. of Providence. And the initiative has since matured into a three-phase project, being the community farm, healthy housing, and the world market. The community farm is going to be 17,000 square feet of agricultural land. The healthy housing is 50 units of low-income housing right here in the West End that has started construction back in October. And then the world market is a direct retail space for the growers on the community farm and also for local entrepreneurs and growers in the West End community. So, and none of this work would be possible without all the important partners that we've been strengthening and working with for the past 5 years with the Sankofa Initiative and also the past 45 years with West Elmwood Housing. And some of those partners that are here today are Southside Community Land Trust, and we have Andrew Cook. Say hi, Andrew.
Hello.
And we have Georgina Sarpong, who is a West End resident and also works for Farm Fresh, Rhode Island.
Hello, everyone.
So you can go to the next slide. The groundbreaking for the housing just took place back in October, and there's 50 units of low-income housing, and the development is well underway. So the site that you just saw, if you want to go back, yep, that's the site of the 17,000 square foot farm. There'll be a greenhouse there, a community kitchen for local caterers, events to be held, for educational space, training space for people who want to get certified in to start their own food business. The land will be, so the agricultural space will be divided between market grower land, community garden beds for use of tenants, and the 1,500 square foot greenhouse. You can go to the next slide. I'll start to go into more detail now about the World Market that we'll really be talking about during this webinar. So the World Market is a weekly celebration of food, community, and culture. The market provides a comfortable communal space for neighbors to meet and access a variety of local, healthy, culturally appropriate, and affordable food. This year, our partnership with the Knight Memorial Library, which is it's kind of in the heart of the West End. It's a popular library. That partnership is really strengthened this year. They allowed us to hold the market on the front lawn. It's a really vibrant community space, and they promoted the market. They allowed us to participate in events at the library to further promote the market. They put up signs for us. They allowed us to use their bathrooms and facilities during the market hours. And just yesterday, we were able to put them in a grant that we applied for, and that committed use of the lawn next year was a really important part. I also wanted to talk a little bit about the neighborhood. So the neighborhood is the West End is the largest and most population-dense neighborhood in Rhode Island. We have a total of 20,558 residents and a population density of 17,479 people per square mile. And it's a very diverse neighborhood. Majority Latino, it's 58.1% Latino, and then we have a large mix of African American, Asian, Alaskan American, Indian, Hawaiian, Pacific Islander, Southeast Asian, and many, many other ethnicities in the neighborhood. So Sankofa Market is also a place, a culturally supportive place for all of those communities. So you can go to the next slide. So as I said before, Sankofa is a reaction to the assessed food need in the neighborhood. At the market this year, our vendors offered a huge variety of local produce, and much was traditional to West Africa and Southeast Asia. These images are from one of our stronghold vendors, Blia Mua from Laos, and he participated in the market last year in the first year, and is a wealth of knowledge around the health benefits of all of his traditional food that he grows, and is able to really tell customers about the importance of these of the produce and connect customers to a different kind of eating. You can go to the next slide. So in addition to the produce, the healthy produce, Sankofa Market connects customers to local artisans, musicians, and craftspeople. This year we had a huge variety of vendors. We had a Reiki specialist, We had a woman who was her first year as she started a Latino-inspired baked good company, and she sold Puerto Rican sweetbreads, and we had musicians and shibori-style tie-dye T-shirts. We had Rwandan baskets, and the library had a book sale every week. We had homemade horchata and tacos and Caribbean food. It was a really great, colorful experience every week. Other services and partners that were formed at the market, we had Clinica Esperanza that had free health screenings for residents. The Met School, the charter school in the neighborhood, came and participated. Their students participated in face painting. They sort of set up their own booth and had their own little face painting business at the market. And also URI SNAP Education had a booth for several market days where they held cooking demonstrations with seasonal and local produce, handed out recipe cards to engage customers in buying locally and at the market. So that was, and then the evaluation component at the market, that was really important. The Brown Public Health Institute set up to take customer surveys about quality, variety, prices of produce at the market, and they evaluated other information so that we can further improve the market for next year. And we're still waiting for those results, but they will be an important part of our planning process for next year. You can go to the next slide. So now I'll introduce Georgina Sarpong, who is a West End resident. She lives right next door to the office here. She is also a chef. She has her own catering company, and she's a program manager for Farm Fresh Rhode Island. She manages several markets in the neighborhood, and she's going to talk a little bit about the partnership with Farm Fresh and herself with Sankofa.
Hello. So as Addie already mentioned, the part where we come into Sankofa, especially the world market, is that as a resident, I've been a part of the committee for about 3 years in the support of the initiative. As far as the world market, being a part of our community access team for Farm Fresh Rhode Island, we were able to connect with Sankofa World Market in creating a relationship by introducing our Bonus Bucks program to their market. Bonus Bucks is an incentive program that we've had for a number of years, more than 5 years, and it was only for our markets throughout the state. Last year, we became recipients of the FFRI grant through the USDA. That funded us a large number of money to expand the incentive program to other markets that we do not manage, and Sankofa World Market was one of them. Bonus Bucks is an incentive program for families that use SNAP benefits, and what happens is once they exchange a number of coins on their card, depending on the dollar amount, we give them more money for free. So for every $5 they exchange with us, we give $2 for free with them shopping for more fruits and vegetables. So again, through the USDA grant FFRI, we were able to add Sankofa World Market to that network. And that's how the partnership between Farm Fresh and West Elmwood Housing, developed. So we provide the technical assistance and training behind that, the coins, and any other updated information that will help the market manager or the market succeed in distributing the coins. Other than that, another way that I, as a resident and being a program manager for Farm Fresh Rhode Island, created a partnership with West Elmwood Housing is collaborating with another organization, Southside Land Trust, which you'll hear about shortly, on the marketing efforts on how to promote our neighborhood markets. As Addie already mentioned, Farm Fresh managed a number of markets two of them which is right next door to Sankofa World Market, and it supports the same community. So what a better way to form a relationship with other organizations that support local food and agriculture that, serves the same community. And we came together and Southside spearhead the grassroots marketing outreach strategy program of how to get our community to shop at all of the markets. And so through that, we had developed plans and executed most of them to kind of test the water, see which one works best, and what efforts are needed to get the community to come out and shop. And then outside of that partnership, being that that partnership was already created individually with the three organizations, we took what we had and what we learned from each other and was able to duplicate it or use it on our own to get other folks to come out to our markets as well. And Southside Land Trust is the other organization, and Andrew will take it further on our partnership.
Andrew, would you like to join us and share a little bit about your role? If we're experiencing technical difficulties, we can go back to Georgina. Or if we're having a little bit of difficulties and want to go back to Adeline. Well, if we're having a little bit of difficulty in Rhode Island, then maybe I'll just turn over to Aliana and I ask you a few questions about your work on the County Health Ranking and Roadmap program. Aliana, one of the questions I have is, can you share with me a success story where you've worked with some organizations in a local community and you've been able to support their partnerships? Just a concrete example of how some organizations have changed their partnership strategy would be very helpful.
Sure, Sarah. I'd be happy to discuss that a little bit. One that comes to mind, and they're doing great work all around, is the Nashville Department of Health. They came to us a couple of months ago, and the team that they sort of presented with was traditional sort of public health and healthcare, and while the members of the team very much understood sort of the multiple determinants of health, and they knew that there was a lot of good stuff going on in their community, they weren't initially well connected with that work. And so over a process of about 6 months, we really worked with them in sort of strengthening their partnership, and they've sort of evolved now into this very multi-sector team. We have a community planner from the planning department, still a representative from the public health department. We actually have engaged 2 neighborhood leaders for some of their very targeted work, and we're now moving on to sort of action planning at the neighborhood level. And that's one of the things that I want to highlight that we are seeing more and more at County Health Rankings and Roadmaps is that we recognize that the county health rankings present data at the county level and can often be used to start the conversation, but locally there is data available at the sub-county level, zip code level, maybe even neighborhood level, and we see a lot of really exciting activity with multi-sector collaborations at that sort of sub-county level happening more and more.
That's extremely helpful. One of the questions that I would love to know is particularly effective strategies you've seen for convening partners. How long did folks take to sort of identify partners? What means do they use for convening? And when are most of the organizations that you're working on switching from sort of planning and into the implementation? How long does it take? that's a couple different questions. So I hope it's not too much.
Gosh, let me start with the convening of partners, and I think that that's one of the places that the partner guides that we have available on the website can be of assistance, because what I think it does is it starts to make the connection of why this understanding of health from many different perspectives is important. And the one that I like to call on a lot is our business guide, because when you're convening partners maybe from a chamber of commerce or from your large employers, you want to understand why health is important to them. And a lot of times it's going to be because they want a healthy workforce, they want less sick days, they also want the community needs to be an attractive draw for the workforce that they're desiring. And so being able to speak their language in convening is important. And I think our guides can help provide some of that foundation as you start to craft your message and go out and talk to people and work sort of the local community networks for engagement.
Yeah.
And Sarah, help me out because you asked a lot. Yeah, go ahead.
No, I was just going to say, no, that was fantastic. The language issue is one thing that comes up again and again in this issue with cross-sector partnerships. And the partnership guide that the County Health Ranking Roadmap program has put together is fantastic, and we'll link to it at the end of the presentation so folks can take a look at it. We also do have a glossary of health and housing terms, which is on our website to sort of help with the health/housing translation process, and we'll send a link to that too. I did want to go back to Rhode Island because I think we've got them back. Andrew, am I right? Yes, now we can hear you. Thank you.
You could hear Georgina too when she was talking?
Yes, we could hear everybody, but somehow Andrew, poor Andrew, we couldn't hear you.
When we turned the phone over to him, it came off and the speaker, it just got disconnected, so.
Well, you know, I never have technology issues myself. I am immune from them. Please laugh, that's a total joke. Yeah, right, exactly. Well, Andrew, thank you again for joining us, and we'll switch over. And thank you, Allie, for pinch hitting in that moment when we lost everybody in Rhode Island. Andrew, thank you.
Yep. Okay. So, as Georgina said, I work for Southside Community Land Trust, which is an organization that does a bunch of different programs around healthy food and growing food in the province area. In terms of the Sankofa market, our two main collaborations were running a collaborative booth of small market growers and then some farmers market outreach, similar to what Farm Fresh did. So I'll start with talking about the collaborative growers booth. So we had a booth at the Sankofa market where we had 4 growers who grow on our land. So we have land, mostly community garden plots in the city, and then a couple of spots a little far outside the city. These were growers. They were all immigrants. 3 of them were refugees. They grow on a quarter acre of land or less, so they're pretty small scale. 2 of them had some experience growing for commercial production. 2 of them didn't. And so at this booth, they were able to all bring their produce that they'd grown. As Addie was saying a couple of slides ago, a lot of the produce that they brought was very hard to find in the United States, like in general, but very in demand among the immigrant groups in the area. So, for example, we had 2 ladies from Liberia who brought callus greens and callaloo and water greens and bitterball, all of which, you know, they would have Liberian families come and buy like $50 worth at a time because they couldn't get anywhere else. So they were able to sell this collaboratively. So at the end of the day, they all got paid out according to how much they had sold. Doing it together instead of having each person having their own booth helped a lot. Some weeks one person wouldn't have a lot, but if they just had a little, they could still bring some, and they didn't have this big empty table. You know, we were able to keep the table always full. They were able to trade growing tips with each other and, you know, suggestions on farming practices. we were able to help them with accounting. So at the end of the market season, we were able to talk to them, each one individually, and say, well, you know, this is what sold well for you, this is what didn't. That was very helpful because a lot of them have very low literacy and low numeracy. And so, yeah, in addition to that, at this market booth, we also, Southside Community Land Trust, that is, sold tropical fruit at cost. It was not fruit that we've grown. It was all fruit that doesn't grow in New England. And the reason we did that was because there's a very high neighborhood demand for things like limes and pineapples and mangoes. And so West Elmwood Housing asked us to sell that fruit to make the market more complete. So the idea being that the more of their groceries that people can get at the market, the more likely they are to actually go there and shop and make the rounds of the different booths. And so, yeah, the market booth went well. This was its first season, but it went well, and the way that we think of it as going well is that the food that was grown in the neighborhood got sold to people who live in the neighborhood. The growers made some money. Their sales overall went up throughout the course of the season. The growers, especially the two inexperienced growers, gained valuable experience in how to set up a market stand, how to keep track of sales and produce, how to, you know, interact with customers and make a pitch. So it was overall a successful first season. And then some of the things we're thinking about for the market booth for next season are getting more growers. As I said, we have 4 this year, but I think we have room for more. And increasing the growers' ownership of the booth, and especially the accounting side of things. That was the accounting side was where Southside Community Land Trust skills most came into play, and we would love it if the growers could do more of that. As I said, they generally have relatively low literacy and numeracy in English, so you know it'll be a process of building their skills, but I think we can do it at given time. And so yeah, that was the market booth. Okay, so for farmers market outreach, as Georgina was saying, this was something that Southside did in partnership with Farm Fresh. We targeted 3 markets in the neighborhood, so Sankofa Market, which is the newest market, it's only its 2nd year, and then also 2 other markets nearby. And in this outreach, we used a few different methods. We did door knocking, we did postcards, we did lawn signs, and we did community presentations. So I'll start with the postcards. We designed a promotional postcard that is similar in appearance to the slide you just saw, a little different. That slide you just saw was the lawn sign, what we put up in the neighborhood. The postcard had the same logo, the same sort of green sunburst, the same messaging, about 40% more EBT. And we kept the same elements to try to make it consistent so that when people saw these different advertisements in different places, they realized that it was all for the same thing, the farmer's market. So if you want to go back to thank you. So we sent out just under 5,000 to the 02907 zip code, which includes a large portion of the South Side and includes the areas around the 3 markets. And the postcards also had a raffle entry on the back. So there are instructions that bring this to one of the farmers markets, and we'll enter you to win a gift card. And so some people did that, and 5 people won each $50 in money to use at the farmers market, which they were all very excited about. A nice feeling to call them up and say, you won $50 at the farmers market. In addition to the postcards, we did the lawn signs. We placed those on main thoroughfares in the neighborhood. It's pretty straightforward. Tried to put them in areas that had good pedestrian traffic. And one thing that was nice about the lawn signs is that, by and large, property owners were extremely friendly to us putting up the signs on their property. They all supported the project. We did some door knocking, and one thing, on this map, the 3 red dots are the markets. The 2 blue dots are the Southside office and the West Elmwood Housing Development Corporation office, which is also where the Sankofa building is going on. And the black lines are the streets that we door knocked on. And so this door knocking was done by Southside Community Land Trust's full-time staff, me and 2 other people, and our summer youth interns. So those were high school students, mostly from the neighborhood, who would go out with the full-time staff members, and we honestly let the high school students do most of the talking because they were very motivated. It was a great leadership building activity for them. The people that we door knocked on were all very receptive to it. So yeah, door knocking was great, both because it gave the high school students a chance to really step into their own and make the case to their neighbors and friends about why this market is valuable. And the responses we got were by and large extremely positive. There wasn't really any negative sentiment about the market. The most common reaction was, oh, I didn't realize that was there, that was great, or, oh, I didn't realize that you gave a bonus for using EBT, that's great. So if you go back to the previous slide, we knocked on just under 2,000 doors, and people actually came to the door at about a quarter of them, which for this kind of work is a pretty good rate, response rate. And then lastly, the community presentations. We did at a bunch of different sites, mostly all on the map. I didn't mark them, but they're all in that same neighborhood. To give you a sense of scale, to walk from one end to the other of this map, maybe like half an hour. Providence is not very large. So yeah, the community presentations were another chance for the high school interns to really step up and take a leadership role in explaining to their community why healthy food is important and the fact that there are opportunities to get healthy food affordably. And another great thing about the community presentations is that some of the farmers were able to join us for them. Unfortunately, the farmers are pretty busy in the summer, so they couldn't make most of them, but we were able to get some of them to show up at a couple of presentations. They brought food samples, and then, the next week at the market, people would come to the market and say, oh, I had that corn you gave me at the community center last week. I want, a whole bag of it. So, yeah, that's that for the farmers market outreach.
Great. Thank you, Andrew. So just to kind of wrap up, I guess, sorry, this one go off. Just to wrap up, Georgina and I were sort of going to talk about kind of going forward next year. That was the first year that Southside ran the neighborhood marketing campaign, and we really want to continue to work together next year to revamp up the campaign and make sure that we're working together to promote these 3 markets as a unit. Because the more, the strength in these partnerships is really powerful as opposed to just, working individually. So at Sankofa, we did see, each week it seemed that more and more people were showing interest. Towards the end of the market, we did have people responding to the door knocking and flyers that Southside had sent out. And I don't know if Georgina wants to talk about at her markets how that.
Yeah, so with the partnership that was created with both organization and ours, and our numbers, because the way we collect our data for consumer, or one of the ways is looking at the Fresh Bucks system, which is a token system, which I briefly touched upon earlier. So whatever we receive back, that's how we collect the data to see how much was made at each market. and this trickles all the way down to Sankofa's market as well. And we've seen with our two markets, which was Broad Street and Omri, which is a part of the three markets in the neighborhood, our credit card numbers have went up probably by $1,000 this season, and our EBT coins, especially bonus bucks, for both markets have went up. One of them have went up, I believe, an extra $2,000. So just having that collaboration and coming up with a partnership on how to market something that's going to better our neighborhood and our community, we've seen a difference in our numbers. By observation, more people are more aware of the local food that's being grown in their neighborhood, the partnerships that have been created through the programs that are in their neighborhoods. So it's just more of an awareness, and it takes more than one organization or one person to get the word out. Like Addie already mentioned, next year we look forward to all working together again in strengthening the partnership and trying new ideas and sticking with what works and make it better.
Yeah. I think this final slide is just kind of to show, we had all these really great community organizations partner with us this summer, but also there's, it was a great breeding ground for neighbors to meet and connect with one another, and those partnerships to be strengthened as well. The folks you see here, two of the men on the drums are from DARE, which is Direct Action for Rights and Equality, an organization just down the street, and they have a drum circle, incidentally named Sankofa as well. And so they would come every couple weeks and play drums at the market, and then musicians would sort of just show up impromptu and play together. It was sort of this like jam band that happened weekly, and it was really great. Brought people in that didn't know what the market was, and it let people kind of connect around music and food, and the comfortable space in front of the library was really a colorful and a vibrant place to be. I heard numerous people say that they had met people, they had met new neighbors and met folks in the neighborhood that they didn't realize lived right in their neighborhood. So it was a really both successful in that it connected people with healthy food, but also reconnected people with their neighborhood. I think that's it for anyone for now. Anyone have any questions?
Thank you very, very much for sharing this story. This is amazing. It's making me hungry, and it makes me want to turn on some music. But I will not cut short the webinar to put on music because I still have a million questions, and folks have been sending questions. So let me start and sort of just ask a few questions. One of the questions that came up is, can you help me understand the scale of this market? And you guys did all this amazing outreach. How many people on average are coming to the market, in each incident by the end of the summer?
I'll talk about Sankofa. It was really the first year. I want to call it the first year because last year was in a different location. It was sort of a pilot year. But this year we had we had over 2,000 visitors in total. I think it averaged to 170 customers per week. And some of that varied depending on if we had an event that day. Genesis Center, which is a ESL training and resource for immigrant communities, also came and did a cook-off. So that day we had a huge number of customers just to check out the cook-off and check out the market. So it really depended, but 2,000 overall. And Georgina's markets are much different because they've been running longer.
Yeah, so the two other markets that Farm Fresh manage, one of them been around for close to 20 years. The other one been around for about 6-7 years. So the one that's been around for close to 20 years, that market attracts up to 250 people per market. On its highest day when there's events like other neighborhood events and et cetera, we can have up to 350, 400 shoppers or attendees. The other market, which is the Broad Street market, is more, that market has up to 150 on a standing day. Again, because our markets have we have a nutrition education family program attached to the market that attracts a large number of families. So that 150 can go up to 250 depending on what's happening that day, but that's the standing number. Again, like Addie said, this is Sankofa's first year, which was a really good year, especially when you're starting a farmer's market, with the vendor mix and the amount of people coming out. And again, the partnership that we created to promote all three markets as a unified front gained the attendees. And at our other markets, like the Armory Market and the Broad Street Market, we do cross-promotion there because they're all on different days.
Fantastic. You know, one of the things I just kind of wanted to be was that a fly on the wall when the Sankofa market was first, sort of that idea was generated in folks' minds. Do you know what sparked the idea, or where did the idea come from for the Sankofa market? I think this is probably best for Adeline, if you don't mind sharing.
So the idea came from the assessed food disparity in the neighborhood first, and then also the recognition that there is a huge number of immigrant and refugee populations in the neighborhood. So these people come in with a well-rounded knowledge of agriculture. They have food that they're accustomed to eating, and ways of and a lifestyle that doesn't necessarily adapt directly to the American lifestyle. So the idea of Sankofa was to create a space where it would be culturally supportive of both the skill sets that immigrants and refugees may have coming into the country, to support those skill sets as an economic opportunity at the market, also support the urban agricultural community at the market as well. It's a place where, it's a retail place open to really anyone in the neighborhood who has a skill set and would like to further their entrepreneurial skills. To go back and get it, the Sankofa significance means to kind of learn about where you came from to make progressive change for the future. So also Sankofa being the idea that we can reconnect people to the food that they're accustomed to eating, but adapt it to, have that food accessible here, and also teach, ways to adapt it into the lifestyle here that is different than their home. That answer your question?
Yeah, that's a beautiful, it's funny, I have more questions, but it's such a beautiful sentiment. I just almost want to pause and sort of just acknowledge what a beautiful sentiment and sort of way of thinking. I love that. Thank you. One of the other things that came up, and this is a very specific question, but Andrew, would you mind sharing, you shared that some of the growers in your booth were sort of really engaged with this from a sort of an economic perspective and in serving as their own social enterprise, and you were hoping that they would take on more of the accounting functions. So I'm just curious about, sort of, are you thinking about providing training to help folks sort of step into that role, or how are you hoping to take that next step with your growers?
I think one thing that we did in the past couple of months that was helpful was to give each of them their accounting sheet of their sales for each week and for different products for this past season. And so we had like a individual meeting with every grower as a sort of like post-season debrief, like how did it go, how did you feel? And so we like showed them all of their records that I had kept for them, and like, okay, this number means this column means this. So I think that was helpful, and a lot of them, have family or children who have lived in the U.S. and are more comfortable with using numbers and literacy, and so they're like, oh, okay, I'll have my son help me like read this and figure and plan for next year. Because a lot of the growers we had were, grandparents, sort of late middle-aged. And a lot of the training, I think, is going to be very hands-on next year. About Southside does sometimes do summer, winter classes. So like last winter we did a class on growing for the market. We might do it again this winter, I'm not sure yet. But a lot of it is going to be hands-on, so just as Southside is keeping the records next year, to just actually make the time to sit and do it with the growers, and that takes more time. It's slower, but it'll be a learning experience. This year, because it was the first year, we were sort of figuring it out ourselves, so it was a little harder to also have the growers sit down and look at it with us, just because we were trying to figure it out on the fly every week. But now that we have a system down, it'll be easier for next year to just have them do it with us as we do it. And yeah, we also always try to push and promote opportunities for our growers to learn elsewhere. So for example, we're thinking of sending some of them, if they have time, to a farm finance workshop next week that another organization in Massachusetts is running, but is nearby, and we have the money to pay for the registration for a grower, so we're thinking of sending them to that. And then I also have been in contact with the organizers of that to let them know, like, hey, heads up, we're going to send some people with low literacy and low numeracy, you know, so do you have ways of supporting those people in running this farm finance workshop? So I hope that answers your question to some extent.
No, that's fantastic. Thank you. And I want to be very respectful for everybody's time. This has been wonderful to learn about everything you guys are doing, both nationally and locally. And with that, we'll close our webinar series. Thank you so much. And I want to thank Kimberly for all her work on this webinar series. And also, we'll be in touch. If you go to the next slide, you'll see that there's some resources which we'll be posting on the website just in case folks want to follow up on some of the things that came up. And have a wonderful afternoon, and hope it's filled with food and music like this webinar. Thank you.